Hello, I am Dr. Vinita from Department of Public Administration, Usmania University, Hyderabad. Today, we are going to learn about policy evaluation process in India and USA, a comparative analysis. The objective of this unit is to explain the meaning of public policy evaluation. After going through this unit, you will be able to understand policy evaluation process and values in policy evaluation. The problem involved in public policy evaluation and policy evaluation process in India and United States of America. Coming to the introduction, much of the interest in the public policy making process focuses on the dynamic energy that goes into the decisions. Once the policies are made, interest often drops off in favor of focusing on other problems in need of resolution, and discussion begins afresh. The outcome of the policy after implementation can be as or more critical than the development of the policy itself. Still, there is one more step that needs to be completed in the public policy making cycle, that is, the process of evaluation. The concept of policy evaluation. In its simplest form, policy evaluation is concerned about the learning of consequences of public policy. It means evaluating alternative public policies as distinguished and describing them or explaining why they exist. Basically, there are two typical tasks in policy evaluation. One task is to determine what the consequences of a policy are by describing its impact, and the other task is to judge the success or failure of a policy according to a set of standards or value criteria. Robert Hangman claims that the central tenet of policy evaluation research is its focus on the activities of the public sector and its influence on society. As such, it is the effort to understand the effects of human behavior and in particular to evaluate the effects of particular programs. Another definition is policy evaluation is the assessment of the overall effectiveness of a national program in meeting its objectives, or an assessment of the relative effectiveness of two or more programs in meeting common objectives. Still, another definition is that the evaluation of agency, programs, or legislative policy is the use of scientific methods to estimate the successful implementation and resultant outcome of programs or policies for decision making purposes. What differentiates policy evaluation from other types of policy analysis is the focus on policy results or consequences as opposed to policy features or causes. The needs and objectives of public policy evaluation. Many a time we find the objectives in the public policies and the availability of the means employed to achieve these objectives are uncertain. As a result of this uncertainty, the direct and indirect effects of a selected course of action cannot be accurately predicted. Hence, the evaluation of the impacts of an ongoing process of action, that is the policy, becomes necessary to determine whether the action should continue or modified, terminated or replaced with an alternative course of action. For instance, the employment generation policies tend to change from time to time, place to place in different contexts, ranging from self-employment schemes to food for work programs. Evaluation of public policies leads to policy adjustment to provide for greater effectiveness or changing conditions or both. This is particularly necessary when the resources are diminishing and priorities are to be readjusted. Policy evaluation also provides reliable information on the extent to which objectives need redefinition. Evaluation are undertaken to meet three objectives. First, enhance the accountability of the individual or unit in an organization or a supervisor or other government body. Second, improve the operations of a program by making it more efficient, economical, effective or relevant. Third, expand the scope of the field through new developmental techniques in research and design. Policy evaluation process. Evaluating policy program is not easy. It requires a framework. In theory, it involves several steps. Usually, for conducting an evaluation, 5 steps are the most significant. First, identifying purposes of evaluation. Second, identifying areas of evaluation. Third, choosing evaluation methodologies and organizing data. Fourth, analyzing the results. 5. Writing an evaluation of report. Identifying purposes of evaluation. The first step in conducting policy program evaluation relates to identifying the purpose of evaluation. The public institutions or policy planners who seek evaluation should articulate questions as to why they want to evaluate this policy. The evaluators then should identify the management concerns, questions and issues on which the evaluation should focus. Identifying areas for evaluation. Once the evaluation questions have been articulated, it becomes possible to identify areas of focus for the program. For example, if the questions related to unanticipated environmental impacts of the forest policy, then the evaluation should better focus on technical aspects of the policy. The management team can identify those areas of the program which will yield the most supportive information. Choosing evaluation methodologies and organizing data. Choosing appropriate evaluation methodologies is challenging. It involves collection of reliable data from different sources. Here, it also involves developing the equipment for recording information and pilot testing them. The pilot test is useful especially if data collection is going to be entrusted to other people who may not have background in policy management. When the methodology is developed, the next step is the processing of composing data collection and organization. The whole process of data collection and tabulation has to be planned for timing, sample selection, cleaning, tabulating and storing the data. Analyzing the result. Data collection and cleaning is a step in the data analysis. It means culling data which is incomplete and combining data is set according to the questions which are designed to answer. Data tabulation means organizing the data into an analyzable form. After the tabulation, the data is ready for report writing. In many respects, the systematic collection of data and information helps in making reasonable judgments about the disposition of policy program inputs and outputs, that is evaluation. Writing an evaluation report. The evaluation report requires the maximum attention. It should be well written and should cover all the major points of the evaluation. It should be a summary of the recommendations of the management issues that launched the evaluation. Besides this, the evaluation report should be accompanied with technical additions. The entire document should be comprehensive and should enable other specialists in knowing the methodologies and analytical tables at some later point of time. Evaluation in India. There are three broad forefronts to the agenda of most developing countries, viz. Privatization, decentralization and new spending priorities. Evaluation can assist the reform process as outlined below. First, privatization. Privatization efforts have not always worked as well as anticipated. Governments realize that a simple transformation from state ownership does not essentially bring efficiency. Conveniently, governments are now using the regulatory instrument as a means of promoting competition and encouraging growth. Second, fiscal and political decentralization. Decentralization will result in improving allocation as decisions are made at the local level and public resources will be more responsive to local needs. Third, new spending priorities. Increased resources are being allocated to social priorities in developing countries, particularly education, health, welfare, etc. This direction is reinforced by the international financial institutions that view reduction of poverty as criteria for international lending. This redirection, however, will not certainly lead to growth if the proper incentives are missing. Indeed, the equity priority will not essentially have the distribution implications sought, as new expenditures may increase the income of the suppliers with marginal benefits for the needy. Thus, evaluation can help developing countries by providing information and benchmarking to determine if regularity changes are approaching efficiency, that is competitive norms, developing performance measurements, standards and avoiding earmarking as guidelines for resource allocation, implementing strategic evaluations, broad evaluations on key priorities to develop feedback and allow for redirection before the policies and programs become forever entrenched. Values and public policy evaluation. Just as values plays an important role in public policy making, implementation and analysis also plays an important role in policy evaluation. It is not only policy makers or implementers who requires value systems as guidelines or who bring their personal value judgment to the policy arena. Policy evaluators also require value systems as guidelines and carry their personal values into the evaluation process. Although policy evaluators are perceived as being rational and neutral, it would be unrealistic to expect them not to wish to have specific values manifested in the policy adjustments which follow evaluation. The evaluators' values are, however, only one set of values. The institutions involved in turn have their sets of values which guide them in evaluation. Furthermore, members of the institution involved often represent different professions with their own sets of values. All these sets of values may influence the evaluation of public policies and could become a potential area of conflict of interest. The policy process, evaluation, analysis and revision in United States of America. Evaluation stage. Evaluation is an appropriate stage after the policy implementation, as it is effective to evaluate the policy effectiveness in terms of achieving policy objectives. Along with this, it should also be noted that evaluation will be based on formalized outcome indicators and measures. An evaluation plan should also discover the following things: the short term and long term expected outcomes from the implementation process, how the data relative to healthcare policy will be collected, how the relevant data will be evaluated. When evaluating the needs for all individuals to provide health insurance, there are several key factors that would need to be addressed. First would be to evaluate the number of individuals who are currently without insurance, the reason for them being without insurance and the strain that this is putting on the economy. Next, the second and third part of this would be to describe and design the program providing access to and mandating coverage for all individuals would be the policy being described. The design of this is to provide insurance for all individuals at the rate that is affordable, while making it mandatory, take some strain off the economy. Next, we would gather more information related to how this will work and what the outcome may be. Last, we may make a decision about the validity of the passing the policy and list the benefits of doing so. Analysis stage. Policy analysis is used to determine the policy ability to achieve a given set of goals. Healthcare policy analysis is a multidisciplinary method to evaluate public policy that aims to explain the interaction between the institutions, government bodies, and interest in the process of policy. Health policy analysis is useful to get a firm grip of past failures and successes to better build a plan for the policy execution future. The following are the healthcare analysis stages: verify, define and detail the problem, establish evaluation criteria, identify alternative policies, evaluate alternative policies, display and distinguish among alternative policies, monitor the implemented policy. In relation to healthcare reform and establishing coverage for all individuals, the analysis step would be as follows. First, the stakeholders will determine the number of individuals without health insurance and the strain on the economy. Second, the criteria for how to evaluate the policy would be established. Next, alternative policy that could be beneficial would be described and discussed. Fifth, all the policies that were mentioned in alternative will be compared to mandating and helping to provide coverage for those without coverage. Last, the policy would be implemented and the related bodies of government and the stakeholders would monitor the policy to protect its success. The policy analysis is more complex process than problem identification because policymakers weight their decisions on several factors. Policy analysis focus on the political cost and benefits of healthcare policy reform. Harrington and St. The policy maker makes their decision on the basis of the following factors that could contribute to meet policy objectives: the issue's technical merits, the potential effects of the reform policy on the political relationship within the bureaucracy, government groups and their beneficiaries, the policy change potential impact on the regime's support and stability, the perceived harshness of the problem and the government whether or not in crisis, pressure or support from international healthcare agencies, revision stage. In the revision stage, the legal procedure would be followed by the governmental bodies which must follow the legislative stage and legislative bodies approval process described. In the first section of this process, they follow the federal legislation process through Congress proposed revision bills for months or years before the healthcare policy or bill become law in the United States House of Representatives. The revision stage is used to modify the policy using principles for planning and regulating the healthcare. This means that some changes in legislature could take place in the policy implementation. Evaluation offers the opportunity to access outcome of the public policy making process and reshape the direction of that process. It is the mechanism that compares promise with performance as well as the linkage between the present and the future. Although measurement characteristics, quantitative assessment may imply a clear-cut benefit of some form of evaluation. The process is often dependent upon values and issues, qualitative assessment that underlie the policy under review. In addition, the results of the evaluation experience may be affected by the values of those individuals and agencies assigned the evaluation task. Explain the policy evaluation process, discuss the problems involved in public policy evaluation, comment on the policy evaluation process in United States of America.